Idan-Toyota Corporate Social Responsibility Initiative Asset Handing Over Ceremony da aji February 12th day the zone nyai tu pai da park chumukidi madeba luese. The asset handing over ceremony aji laga chief guest ase Dr. Nipirio, Chief Minister of Nagaland, aro special guest ase Y Padan Deputy CM and Home, aro inaga kuna honored guest ase Vigram Kulati, Executive Vice President and Country Head, Corporate Affairs and Governance, Toyota Kirloskar Motor, along with Government of Nagaland laga officials can be aigena hisa loise. Abi ami kan joigena Idan-Toyota CSR initiative asset handing over ceremony program laga opor de ami kan sai sabo enaga korina Idan chairman logo debi edu juntu asset handing over ceremony ase edu kiman districts kan de holebi pathai ase kinaga ase dukan la details opor de janina ami kan huta hudi kurisa. But firstly, let's have a look at the program.
This CSR initiative was actually started by Honorable Chief Minister when he visited Bangalore late last year and interacted with the Toyota team. Gulati's son was there, he hosted us for dinner and took us around with your whole team. And it was during that visit of the Chief Minister to Bangalore and interactions with the Toyota team and other corporates that Chief Minister initiated this CSR initiative. After that, the entire CSR team was here in Nagaland. They are here today again. They came and visited our office, interacted with us, visited the hospitals and the schools, and together with the concerned departments carried out gap analysis studies. The fact that CSR initiatives are initiated well in advance was a disadvantage for us because we got into this vertical very late after the Chief Minister's visit. CSR initiatives, pitching by various institutions and governments, take place a year ahead of next year's plan of action. But this year, within the same financial year, just a few months back, Chief Minister was in Bangalore, the team came here, and during the Hornbill Festival, as part of the roundtables, as part of the government, private sector and corporate world meetings that take place during the Hornbill Festival, an MOU was signed between Government of Nagaland, Idan and Toyota, which was exchanged in the presence of the Chief Minister in December last year during the Hornbill Festival. Today, we are distributing in a symbolic manner CSR equipment for medical facilities, selected schools to the tune of more than rupees 10 crore. 4 ambulances which have life support systems in them that will be of great value and help to our citizens. And sporting equipment, school requirements for 2 selected schools as a pilot project. In the schools we are giving furniture, we are giving support system, we are giving equipment for the kitchens so that midday meals can be prepared in those schools. We are giving sports goods to children so that they can use these sports goods for their sports initiatives. This is only a beginning, and we hope that this coverage goes beyond the urban and developed areas into the interior regions. I personally wanted some of this equipment to go to the backward districts and the interior areas because those are the regions that really need this equipment. But as I said, this year we started late. Time was our enemy. I and the government with the Chief Minister's support assured that with support from Toyota, hopefully, we will do gap analysis of interior hospitals and support them similarly like how we are doing this time.
Idan has played the role it was created for building partnership that deliver real outcomes on the ground. This initiative is special because it is planned with clarity and executed with discipline. The project focuses on 6 districts: Kohima, Dimapur, Newland, Chinugidima, Teminu, and Zinugudo. And it strengthens essential healthcare infrastructure while improving educational facilities in selected institutions. Under the healthcare component, the project has been provided advanced life support and ambulance to 4 healthcare centers and critical medical and non-medical equipment across 11 health institutions. Alongside this, the education component has supported, as mentioned by Idan Chairman, 2 selected government schools as a pilot project with furniture, sports, equipment and kitchen items to improve the learning environment. The assets being handed over are public assets. They are not for display or for occasional use, but are for daily service. I urge all beneficiaries, departments, and institutions to ensure efficient and judicious use of every asset. These must be maintained properly, deployed wisely, and keep functional.
Our journey in Nagaland started in 2013, and I must acknowledge our partner here, Vaiko-san, and he has been with us in this journey since 2013. Our operation started with one dealership in Dimapur here in 2013, and it's been quite a journey. And honestly, we couldn't have made it here without Vaiko-san's continued support. Through him, Toyota and dealerships, particularly Vaiko-san's engagements here, business operations, provide employment to around 180 people, which gives and touches the lives of around 720 people directly. There has also been a remarkably very high level of employee retention, which really goes to show the tremendous work that Vaiko-san and his team has done in upholding the philosophy of caring for people, which is deeply embedded in Toyota's philosophy. So thank you, Vaiko-san, for that. We've also seen, with the help of, again, Vaiko-san's team, our endeavor to roll out Toyota Technical Education Program. This is an initiative aimed at skilling especially rural youth, so that they can find meaningful employment. And Nagaland, we also have TTEP that was launched in 2022. The best thing about this initiative is it does not only impart world-level skills to the students, but also it gives an opportunity to get into the employment with our dealers. And again here, our dealer partner has been really supportive, and his dealerships have given employment to the children who've come out for this initiative. Two big pillars, basically where we've operated here: strengthening healthcare, which means supplying medical and non-medical equipments, and also ambulances to 11 health centers, which includes 5 primary health centers, 4 community health centers, and 2 district hospitals. We feel that this is really going to make an impact in terms of helping the communities, facilitating, working with the government in providing better healthcare. Enhancement in quality education, which revolves around supply of school furniture, sports material, and kitchen equipment, focusing around 2 schools to begin with.
For the state of government, these 2 departments, health and education, is our top priority department, because the citizens has to be healthy, and any student or any born baby has to be educated, has to be literate, and that's how we progress. I had a study. So when the statehood was born, 63 years ago, in 1963, the literacy rate was only 22%. But because of the commitment and support from different projects, our state now stands at 96% literacy rate, which is one of the highest in the country also. And not only literacy, but quality education being important. But those are, facilities are available, quality education are in the towns and cities where it is near to reach. We have interior places yet to reach those facilities and also quality education. So as mentioned earlier, I think if this kind of CSR continues to reach particularly to the ENPO area, the backward, the last mile of the state, it will be highly appreciated, and your commitment we really appreciate. We'll continue to look upon you, to have collaborations and friendship. And I hope our youth will take a full advantage of this. And also today the assets handing over to the departments, I hope you'll make good use of it. And these materials, why even the school, see, up to utensils. We want this to be a benchmark. Insisting on quality control. You heard about children in Japan, in schools. The schools, the teachers, they are like friends. They come to school and they maintain cleanliness in their homes, also in their working place and in the schools. They all take off their shoes, go inside the schools. Then they eat the same food, teachers, students, and after the school is over, they will work together again to clean all the utensils, plates, cups, kitchens, kitchens, and then school itself. Then everything is over, then they will take holiday together and come back to the routine. So this kind of, habits. And why they are going to the smallest detail is, I think we have to learn from them.
Shall we pray? Father in heaven, we want to thank you for this wonderful day once again. Thank you for this initiative. I pray, Father God, for all these 4 ambulances that goes to different departments to meet the needs of people, Father. I pray.
Viewers, ami khan loge de Idan chairman Abu Mehta ami khan lode se aji laga handing over ceremony laga opor de bi ta loge de details pa huta huti kuri sawo. Sir, thank you so much for your time. Aro ami kwa nishna idia apni do aji asset handing over laga program opor de apni details pa koi dibo parbo itu gari khan do kiman da schools nile kiman da districts khan de jawole ase.
Thank you very much. First of all, my thank you. I want to say big thank you to Toyota Kirloskar Motors for supporting us in this CSR initiative, Corporate Social Responsibility Initiative of Toyota. Edu Chief Minister Sahab para Bangalore jaine tahan logo meeting kurise, moi tahan logo duibar timbar meeting kurise. Aru December day Hornbill Festival time day moi khan business round table corporate khan logo partnership kurigine discussion kuratum day MOU sign kuro parise. Today, within weeks of that MOU being signed, I'm happy to say that Nagaland is getting health equipment, health support and educational support from Toyota to the tune of more than 10 crores rupees, which will be distributed to 6 districts. This includes X-ray machines, health equipment, furniture and equipment for schools, and also critical life-saving ambulances for 4 districts, 4 ambulances. And I request our media friends also to give coverage to these ambulances, see the visuals and record what are the facilities that are included in this ambulance, because ambulances are supposed to give life support, they're supposed to give medical care at site, paramedical care, and these ambulances are fully equipped with that. So I'm very grateful to Toyota. As I said earlier, 6 districts will get these benefits. What we did with this scheme was that we used the Toyota team and the medical department to do a gap analysis. Kundu hospital de, kundu health center de, ki facility komti ase, ki lage, tate laga doctor, tate kana nurse khan logo kotha kurigine, ekta assessment kurigine, mohan itu pichide, itu saman dibo kurigine, mohan finalize kurise. Aro another thing is that mohan Idan department itu scheme do full transparency, full open, are in a very maintaining the best practices and higher standards. We have implemented this program. Kile mane ekta, not a single rupee was transferred to our account. We requested Toyota to use their own vendors to do their own procurement, to do their own placement and implementation, so that we build trust, we build confidence, and we show that whatever CSR funds come to us, to our people, 100% is utilized on the ground. So that's the way we have managed it, and I'm hopeful that we are able to continue this program. We seek the support of Toyota and other corporate companies to also cover the whole state. Itusal, amikhan, itusal nohine, itu ola scheme do. Our first intention was we wanted to cover the backward areas, the interior districts. Time thaganai. Kile mane itu within few weeks mohan target kurise, March ending la agede itu implement hobo lage, holibi in the next round of CSR activities, especially in healthcare, we will ensure that these facilities reach the backward regions.
Sir, could you kindly amihala viewers kangi kuidiwo parabo the 6 districts kanto kun khana?
6 districts include Kohima district. The Kohima NHAK Naga Hospital Kohima needed a lot of critical care facilities, so that is included. Dimapur district, Chumukedima district, Newland, Chemenu, Zuneboto. I think these are the 6 districts that we've covered this time. Because as I said, there was time constraint, and itu Kundu district ki dibulaze, Kundu hospital de Kundu healthcare ki dibulaze, Toyota team wanted to reach themselves and do the assessment. So that was why we rushed into this project, and we have to implement before March.
Viewers, apni kan details par dikhi luise Idan-Toyota Corporate Social Responsibility Initiative Asset Handing Over Ceremony laga upor de aji laga special guest Dr. Nipirio, Chief Minister of Nagaland, aro special guest Y Patan, Deputy Chief Minister, also the Minister in charge of Home and Border Affairs, our honored guest Vikram Kulati, Executive Vice President and Country Head Corporate Affairs and Governance, Toyota Kirloskar Motor. Tahan babi tahan laga presentation de huilibi kota kura daim de itu Idan Toyota itu CSR initiative lakan laga upor de aji adi apni kan dikhiwa ame laga piche de ye de ambulance kan itu choita districts te pathawole ase school kan de huilibi aron huilibi medical department kan de huilibi aro on top of that ye de Idan laga chairman Abu Mehta lode kwa daim de ta janibuli dishe that itu ami kan laga Chief Minister Dr. Rio wa Bangalore de jaigina MOU kan sign kurina aji ye de asset handing over ceremony to luilishe choida district te tahan idu pathawole ase idu kan ase Kohima, Dimapur, Chumugidima, Newland, Chemenu, junior poto khan de pathawole ase guina bi janibole dishe aro yede apni khan already visuals tipi dikhi luise that tahan medical team khan logode bi analyze kurina assess khan kurigina tahan itu pathai ase to choida district ke select kurigina aro they wanted to send it to more districts but still then time constraint honi mi tahan this time de kurbole parna time shortage thakse but tahan la plan ase ki the remaining districts khan de huilebe pathawole aro tahan la main focus to eastern fale nulibe backward fale tahan focus kurise huilebe kwanishna time constraint honi mi this time the choida district pa shuru kurese coming days to huilebe tai khan alag districts khan de huilebe to ambulance khan itu pathawole bi tahan plan ase guna bi janibole dishe itu itia gari patha deba medical side fane hulibi student educational side fane hulibi public khan laga bishi faida hole amikan hope kuri thakibo itia karni mane for more news and updates keep watching global window this is Chanbini with my cameraman Anung reporting from zone 2 by the park Chumukitima